to you.
Good morning, Julia.
Good morning to you. We've just been talking about this row over the issue of care homes. Who said what? Boris Johnson, Keir Starmer, in their letters, and what happened at PMQs. Again, I don't think most people care about a lot of the nuances of that. I think that's irrelevant. I think what is relevant, though, is who on earth thought it was a remotely good or indeed sane idea to discharge elderly patients from hospitals throughout this, including up to early and mid-March, without testing them for coronavirus or making sure they were quarantined when they went into care homes. Who made that decision?
Well, firstly, I think you're right. What the vast majority of people will be looking at is exactly that. Care homes, a concern for people in care homes, and also deep sympathies for all those who've lost friends or family in care homes and beyond. What we did in terms of the NHS and care homes from the start of this, when we look back to February, we were seeing those pictures, which you will remember and others will remember, from Italy, of hospitals overwhelmed, unable to treat people from the community or from care homes because the capacity they had to treat people with COVID had been completely breached. One of the key priorities we set was to ensure that the NHS always had that capacity to treat people from care homes and from the community, and that the NHS would not, for want of a better way of putting it, fall over due to a lack of capacity. And we have achieved that. In the context of care homes, the row yesterday, or the debate yesterday, is important in one sense, because the letter, or the guidance that Keir Starmer quoted, dated from the 25th of February, and this is when we were still in the contain phase, and the scientific evidence was that there was no community transmission, i.e. transmission from within a hospital to the community or within the community. It was still being contained to a relatively small number of people who'd been traced and were being contained. That changed on around the 13th, and I'm conscious of that because I was self-isolating, having had close contact with someone. That's when the guidance came in, which changed it. The context is therefore very important to what was said yesterday. And from that date, care homes were advised a much stricter set of criteria about who should and shouldn't go into those care homes. And what you've seen since is that as soon as the capacity for testing was significantly ramped up, we need to remember at the start of this, the UK, unlike, say, Germany, didn't have huge labs and commercial operations based in our country who were supplying these tests. So we've had to ramp it up rapidly. As soon as we were able to have the capacity to test everyone, we've done so from April. But at the start, the focus was on those key NHS workers for the testing that we had capacity for at the time.
Yeah, but of course, no, we understand why the testing was. We understand why there was. This been explained to us before, hasn't it, by your boss and others that we didn't have the testing capacity. We all know that. However, not having the testing capacity to have hundreds of thousands of tests of people in the community is one thing. From just only testing NHS workers, the point of testing NHS workers was they could be spreading it around the hospital. We know that hospitals is where a lot of the virus was spreading and is continuing to spread. Therefore, testing people who are being discharged from hospital might perhaps be a sensible idea if they can't be quarantined at home and they are being sent into care home situations. That does not explain that decision. I've asked you once again, who made the decision to discharge thousands of elderly patients? We understand the need to get rid of the bed blockers from hospitals without having them tested or requiring absolute quarantine for 2 weeks beforehand. Was it the Health Secretary? Was it the NHS chiefs, Sir Simon Stevens? Was it individual hospital trust chiefs? Because every single person there is on a very nice six-figure salary and they're supposed to know what they're doing, and they didn't, because I don't have any health expertise whatsoever, but I can tell you, I know that decision, not just with hindsight, but that decision then was insane and stupid. Who made those decisions, and when are they going to actually apologise for it?
Well, excuse me. Firstly, I wouldn't, and I know what you did, but I wouldn't use the word bed blocker. There were people who were in hospital.
No, I know you wouldn't. Okay, leave that aside.
But in terms of your substantive point, your main point there, the decisions were taken, NHS England taking the decision that in order to ensure that we had the capacity in the NHS acute trusts in hospitals, that there would be a programme of managed discharges of people from
we know
hospitals.
that. We know that. So it was Sir Simon
NHS
Stevens.
England took that decision on how to manage that process. Individual trusts and individual clinicians will have taken decisions in discharging patients on what was safe and what was not, and I'm not going to get into the clinical decisions that they will have made. But your fundamental point is, were we able to, or could we have, tested everyone at that point who was being discharged? And the reality, as I said, that the capacity in testing, while it's been significantly ramped up, was not there at that time.
Even at that time, you didn't have the capacity, even though we had known since January and certainly from early February, we are talking about mid-March at this point, even though at that point there hadn't been the ability to ramp up testing. Other countries had managed to do so. And it's not just Germany, many other countries had managed to do so as well.
Many other countries did do that, but equally, if you look at other European countries, France, Spain, Italy, they experienced similar challenges, and they've been clear about that. I think it was possibly Belgium, who I heard one of their ministers or one of their commentators speaking just a couple of days ago about experience, as did France, exactly a similar situation in their care homes to what we have seen here. That's not an excuse, that's not saying that it's right, but I'm saying this is a challenge that has been faced across Europe in terms of ramping up testing, but also in the impact we've seen on care homes across Europe.
The Guardian is reporting today that council social care directors warned the government a number of reports as early as 2 years ago that they were not prepared for a pandemic and they wouldn't have enough PPE and that they'd been underinvestment and the total failure to prepare. What do you say to that?
Well, this is, I think, and correct me if I'm wrong, this is the Association of Directors of Adult Social Services in 2018 who did some work on this.
Yes.
And they're a great organisation. I worked with them for many years ago. I was cabinet member for social care on a council when I was back as a councillor. They did great work, and they highlight strategic as well as immediate issues. Those reports were looked at very carefully. A lot of what was in them was not just about immediate. A lot of it was about longer term. How do you reform the system? What do you do in terms of the future of social care?
Did those reports at any point say we're not prepared, we won't have enough PPE, and was any action taken?
Those reports will, of course, have highlighted and did where we could do better. Is that either in terms of resilience, in terms of PPE, or in terms of it? And we've continued to ramp up the stockpile. We did have the stockpiles of PPE, which we continued to ramp up. Social care remains a great challenge and has been for all parties and all governments. It's one we need to face up to in the long term. But we did listen to those reports. We always listen to organisations like ADAS, and we do put in place further measures to support care homes when we get those recommendations, Julia.
Look, let's look at something a bit more positive. The antibody test that's been approved, it's developed by Roche in Switzerland. Public Health England say it's got the go-ahead. Could be 100% accurate. It's just a finger prick blood test. We understand the health department now talks about buying millions of those tests. How quickly can that be rolled out, and what difference will that make to the easing of the lockdown?
Well, you're right in highlighting the importance of this. I think it was probably about a month ago I came on your show and we were talking about where we'd got to with this, and sadly the tests that had been tested at that time hadn't been reliable enough. And I remember, I think it was the Chief Medical Officer saying a bad test is worse than no test in this context. So it's really positive news that we, PHE, are giving the green light to a test that they think is reliable and will give people that assurance whether they've had the virus or not. Now, the level of immunity that gives you is still being scientifically debated, but it looks like it does give you a level of immunity. Those negotiations are currently going on at pace with Roche. I'm not going to say too much about those because I don't want to compromise those, and I want those to conclude as swiftly as we possibly can to get those tests rolled out. And when we do roll them out, I think it's important that they go to the front line first, NHS workers, care home workers, to make sure they know whether they've had the test and whether they can safely keep working. Because you asked what the impact of this is, what the positive of this is, what on the basis of our understanding of the immunity it gives at the moment, having had the virus, is it looks like those staff will then be able to safely carry on working without, let's say on the basis of the current science, without worrying that they will get the virus again or be able to pass it on to others in their care.
Good to end on a positive note, at least. Health Minister Edward Argar, appreciate you.